with UK Public Relations. We appreciate you coming on short notice. I know it's a news day. But with the global and sort of fluid nature of the coronavirus, and also the admonition this week from the CDC about the potential domestic impacts of this and the need to be prepared on a community level, we thought it would be a good idea to gather some of our experts for you to talk with and to hear from about what we're doing as an institution and what we're doing to support the community as an institution. So this morning we've got a couple of experts from UK Healthcare who are on the front lines of how UK Healthcare is working with respect to this virus. And then we've got folks from the campus, senior administrators from our campus side who are concerned with the international student population we have and the expansive global programs we have, and also operationally how we're viewing this issue and responding to it. So we'll go ahead and get started. We'll let everybody sort of go through some comments and then we'll just open it up to questions. So first is Dr. Martin Newman, who's an Owensboro native. He's a cardiothoracic anesthesiologist, and since 2017 he's been the executive vice president for UK Healthcare. Dr. Newman.
Thanks, Jay, and welcome to UK Healthcare. As an academic medical center that is not only the University of Kentucky, but for Kentucky, we are uniquely qualified to provide the expertise and response that's needed in any situation where patient care is needed. And that's not only for our own community, it's for our, but it's for our campus as well as all Kentuckians. We are, again, a healthcare system that is able to respond to a large influx of patients, whether that's the flu or coronavirus. We continuously plan and train to deal with these situations, whether they are due to traumatic injury, whether they're due to infectious disease, and we have the capability and competency to respond to patient care needs in any situation. We're working closely with the local, state, and national organizations that we'll talk about some more, including the CDC, to monitor and to respond accordingly to whatever the situation changes to be. And I'm going to turn it back over to Jay for him to introduce our, again, our real expertise in infectious disease.
Dr. Derek Forrester is an assistant professor in our Division of Infectious Diseases, and he is the medical director for UK Healthcare's infection prevention and control.
All right, thanks, Jay. And good morning. So I'll reiterate some of the things Dr. Newman has said, but as many of you guys know, coronavirus disease 2019, also known as COVID-19, began circulating in China in December, with sustained transmission being reported in early January. Now, in addition to that, multiple countries have reported sustained community transmission as well. Those countries have included South Korea, Italy, Iran, and Japan. As a response to this, as Jay mentioned a few days ago, the CDC has recommended for persons to be prepared for the possibility of transmission in the United States. I will add that last night, the CDC reported the first case of coronavirus disease transmission in the U.S. without a known risk factor in the state of California, and had commented that it was likely that additional cases will be seen. And although the immediate risk to Kentuckians is low, certainly the potential public threat is significant, and that's where preparedness comes in. Since the outbreak of COVID-19 was first reported, we have been preparing for the possibility of cases in Kentucky. We have worked closely with our public health partners in these preparations. We began immediately by implementing travel and symptom-based screening in all of our facilities to be able to recognize potential case and safely care for them. Our priority in this as a healthcare institution is to still be able to provide quality care to patients that need them, that need that, and to do that in a way that keeps our healthcare workers safe and other patients safe. I do want to emphasize that we have not had any patients with this disease at UK Healthcare, and the state of Kentucky has not identified any persons with this disease in the state. In parallel to those plannings that I mentioned, we've also been preparing for the potential of an influx of patients who may have symptoms of this disease. And these preparations have really followed our standard work for influenza preparedness on a yearly basis. Those preparations include making sure we're up to date with materials, with supplies, that medication supply chains, all those things are functioning. Preparedness involving our care environments, local disease activity awareness, testing procedures, etc. We have experience with responding to emerging infectious diseases. I would love to say that this is an outlier, but since I've been in this job, we've responded to Ebola virus disease, to Zika virus, to enterovirus D68, to MERS-CoV, and now coronavirus disease 2019. In 2015, I did want to mention that we prepared for that possibility of Ebola virus disease in the state. Since that time, we've been recognized as an Ebola assessment hospital by both the CDC and the National Ebola Treatment Education Center. Now, certainly this is not, and in November of this past year, we completed our full-scale exercise with the Kentucky Department of Public Health for Ebola response readiness, and that is part of the Serious Communicable Disease Readiness Plan for the state. Although this disease is not Ebola virus, we have clearly learned a lot about preparations as we move forward with any emerging pathogen, and we're using a lot of those things that we've learned to be able to respond in a timely way. Yeah, I want to say too that we realize that should COVID-19 transmission start to occur in Kentucky, that it's going to require a community-wide response. And so we've already reached out to, and we'll be planning additional discussions with our community partners, including other healthcare facilities, to discuss preparedness with them as well, and to have organized simulation exercises with them from a community standpoint. So with that, I'll stop.
Thank you. Dr. Sue Roberts is a professor of geography at UK. She's our associate provost for internationalization, which in that capacity she oversees or provides all the support services for the some 1,600 international students we have on our campus, our education abroad programs, and works with all the programs and initiatives that we have, faculty, students, and staff, literally around the globe. Dr. Roberts.
Thank you. Good morning, everybody. As you know, UK is a major research university, and like major research universities all over the world, it has multiple international connections, and that's part of what makes this university the strongest research university it can be. Every semester we welcome students and scholars from around the world. As Jay mentioned, we have about 1,600 students from over about 100 countries studying with us here at UK this semester. And we do our best to support them in their studies. As you can imagine, the COVID-19 situation has impacted some of those students quite seriously. They have families in impacted regions, and we've been supporting those students as much as we can to enable them to concentrate on their studies and to succeed and thrive here at the University of Kentucky. We are every day working with our colleagues across campus to make sure that the campus is an inviting, welcoming, and inclusive community, and paying special attention to creating that environment on a daily basis for all of our students. We also send students overseas every year from the University of Kentucky. We have a very robust and growing portfolio of education abroad programs. Students can do traditional study abroad, they can research, do internships, have clinical experiences, and even student teach abroad. So there's a wide variety of experiences that we have built into the curricula across the colleges at UK to ensure that our students are ready when they graduate to be competitive and to lead Kentucky in the global economy. This is a very important part of what we do here at UK. Obviously, with about 1,200 students studying overseas each year, we have a lot of pieces to manage, and the virus is something that we're monitoring very carefully to make sure that we can keep all of our students, no matter where they are, safe and informed about the situation. We work very closely with our partners in providing these programs. That might be universities in other parts of the world, or it might be institutions that we work with to provide programming for our students. So we've been in constant contact with those folks. We're also constantly communicating with the students themselves to make sure that they know the resources that are available to them, and to make sure that they understand UK's concern and support for them and their families. We have also a full-time person on our staff whose job it is to scan international media, to make sure he's abreast of government policies and guidelines related to situations such as the COVID-19 virus. And so we have a very proactive and well-tested system for a calm and systematic response to situations like this. So we feel very confident that we have in place the sort of situational abilities to make informed decisions in such a circumstance as this. So we are continuing to communicate with our international students here on campus. We're continuing to communicate with students, faculty, and staff who are overseas or who are planning overseas travel. And we'll be communicating with parents and students who are interested in or who have plans already made to be studying abroad this spring semester during spring break or in the summer. So we will be working hard to make sure that these kinds of critical experiences for our students can be maintained, but all the while keeping a very close eye on the situation as it evolves. Thank you very much.
Thank you, Dr. Roberts. Finally, Dr. Eric Monday is UK's Executive Vice President for Finance and Administration. In that capacity, he oversees all the financial, administrative, and operational portfolios of the institution. But most significantly, for the purposes of this exercise, he oversees all of our crisis management, our risk management, our public safety operations, all ladder up to him, and he is Dr. Capilouto's point persons for crisis communication and preparedness. So, Dr. Monday.
Thank you, Jay. Good morning. So the university has a standardized process for any type of incident, whether it's a weather event or a health situation as we're talking about today. And it's critical as we think about any type of activity or event. The first thing that we do is we look at what are the principles, what are the priorities of the institution as it relates to that activity. So as directed by President Capilouto, as we looked at this event, those are to support members of our community on the campus and wherever they are to ensure the health, safety, and well-being of everyone in our community. Number two, to work in a coordinated fashion and return to or maintain normal business operations. And number three, to communicate as much as possible to ensure that everyone is well informed. So President Capilouto has convened a work group. That work group has met 8 times. We will continue to meet on a regular basis until we, quote unquote, return to normal operations. People on that work group involve a number of the folks on this panel as well as others across the institution. We have representatives from the Office of the President, the Office of the Provost, the Executive Vice Presidents of Health, the Executive Vice President of Finance, Human Resources, Emergency and Risk Management, the International Center, Communications, UK Police Department, and so on. This group is monitoring and appropriately planning a response to this dynamic and changing issue. And we're always guided as we think about our day-to-day responsibilities within this work group by those core principles I shared. We've worked closely with UK Healthcare to coordinate our response and planning efforts. Dr. Forrester, also Kim Blanton, who's with us, has done an amazing job to assist and to help us as we've gone through these days and as we will continue. We've also worked closely with local, state, and federal health officials on this issue. As we've mentioned, we've had no reports on our campus. Everyone who returned to our campus from China is outside the 14-day window established by the Centers for Disease Control and Prevention for evaluation. UK Healthcare and our International Center, coordinating with our work group, have stayed in close contact throughout this process on how best to manage and ensure those protocols. We have also been informed in policy decisions by Council of CDC and the U.S. State Department. For example, at the end of January, based on heightened travel warnings from both the CDC and the State Department, we discontinued any university-sponsored travel to China among students, faculty, and staff for now. Based on similar travel warnings and advisories from both organizations this week, President Capilouto has announced today that we are discontinuing university-sponsored travel to South Korea. Just as UK Healthcare plans for different contingencies, we are conducting contingency planning beyond what we're talking about today and beyond what we know to understand and to spend some more time thinking about what could occur, what could be in front of us. So planned travel, online learning, alternative classroom instruction, impact to our employees, impact to our normal operations. So contingency planning continues. And finally, in terms of communication, we have established a special landing page to provide up-to-date information, and we have continued to disseminate health information to the campus. We will continue to closely monitor the virus and plan accordingly to ensure the health, safety, and well-being of everyone in our community.
Thank you, Dr. Monday. We'll open it up now to questions. If you want to, pretty informal, if you just want to direct your question to the panelists that you want to speak with, and we'll engage in some Q&A.
So I know you just mentioned that all university-sponsored travel to South Korea has been canceled. I'm assuming that university-sponsored travel to China is still in place, but I'm assuming that other students will be able to travel abroad this spring to other countries?
So right now, the only countries which we have placed restrictions on travel are China and South Korea.
For any of the doctors, if God forbid it were to land on this campus, what then is the plan starting on patient one? Again, Frank.
So I'll take it as an approach from a community standpoint. So obviously the first step in that and recognition of a case. And so if that were to happen, then we work closely with our public health colleagues and they would begin case finding and tracking, and they can comment more on that and what that looks like. But that's extensive surveying and evaluation of that person's whereabouts and where they were in the last 14 days. Did they travel anywhere in particular? Were there any gathering situations? Anybody else who was sick? Any family members or people they live with that are sick, etc. So it starts with that, and then it goes on from there as far as case finding. Persons that would be determined to be either at moderate or high risk based on those investigations would then be evaluated and monitored for that 14-day period as well. So you can imagine one case would have a lot of contacts to follow up on, and that's where the work with the health department comes in.
The flu is diagnosed more. It unfortunately claims more lives so far than corona. So why has coronavirus been splattered across everybody's front page? So
Yeah, well, I think there's a saying that fear, that nothing spreads faster than fear, right? And so it will always outpace the virus itself in any situation, any emerging pathogen. That will be true. It has to do with the unknowns. Certainly we see pictures of what's occurring and happened in China as far as disruptions in daily life and businesses closing, schools closing, et cetera, streets empty. And that is frightening to people when they see that. And so we have to stick with what we know, what the evidence supports, et cetera. I mean, in addition to that, we have things like vaccine and some medications for influenza. We don't currently have those things readily available right now for COVID-19, and those are under works and investigations, but as of right now, those things are not there. So certainly it's the fear that propagates a lot of that.
Alex,
Yeah, this was briefly touched on, but have any students, faculty, or staff who returned from China been advised to practice self-isolation or been placed in quarantine in the last month or at all?
I can take that. Yeah, so we have monitored and worked with the health department as well, but we have done self-monitoring and follow-up on a daily basis with a handful of persons who had traveled back for that 14-day period, and they were quarantine has a mandated legal connotation to it, so this was not a legal requirement, but they did stay in their environment, in their home situation, and we followed up with them for that 14-day period.
You said that the hospital is prepared for an influx of patients. How does that look like? Is it more people on staff, more people taking longer shifts? What does that translate to?
Well, it's hard to say with any certainty because it's tiered and phased. you know, the first step of that is to be able to identify environments of care for that influx, and to be able to have procedures in place to be able to bring people in and provide that care. So that, and we're still working through some of those special situations, but that may involve things like you know, different pay schedules, et cetera, to be able to cover some of that influx.
And it may be, again, if you know, in any emergency in that kind of situation, we may be looking at reducing some of the elective or other work that we do to concentrate on the emergency and focus that, so that we have more capacity to be able to deal with emergencies. And that's you know, again, just like the emergency preparedness, you know, on the campus side, we have that same type of emergency preparedness that we go through and practice on a routine basis on UK healthcare side.
So I know that this coronavirus has spread to some healthcare workers as well. I mean, how are you guys prepared to protect nurses, doctors, and medical staff who may be working if someone, you know, arrives at the hospital?
Yeah, and I'll reiterate that that is one of our priorities, is to make sure that the healthcare workers feel safe and protected in these situations. And so we are just reiterating the precautions that are required and necessary, and making sure we have supplies that are available for those precautions. Those reports that are coming out of China, at least the literature is supporting that those spread in the healthcare worker environment has been from unprotected exposure. And so we want to make sure, that's one of the reasons why we're so diligent about travel screening and symptom screening, that we can recognize a patient early and avoid exposures like that.
You mentioned how fear stokes maybe exaggerated responses.
Mhm.
Advice to the general public, do you think it's premature for people who, for example, are buying N95 respirators? What would your advice be generally for the layperson?
Well, my advice to everybody right now, I think we should all be certainly have an awareness for what's going on, and this is still flu and respiratory season as well. So my general advice is to do the respiratory etiquette stuff that I think we should always be doing, but to be enhancing that. So washing your hands on a regular basis, you know, avoiding contact with people that you know to be ill, that you can avoid, not going to work if you're sick, covering your mouth when you're coughing and sneezing, and then, like I said, washing your hands or using alcohol-based hand rubs on a regular basis in between those times. As it relates to masks, so you know, I don't think there's a benefit right now to be stockpiling masks. I don't think there's a benefit really in reducing transmission in non-healthcare settings when you're reusing masks on a regular basis. That's not going to be very protective.
Doctor, could coronavirus like the flu have a season, or do we just not know enough about it yet to make that kind of conclusion?
Yeah, I think there are still some unknowns about the seasonal aspect of that. Certainly, I would anticipate that to be true, just since it does fall into the respiratory virus category of things that are seasonal. And so I know there's a lot of unknowns about COVID-19, but it is very similar to other coronaviruses that we have more knowledge about, and those do seem to be seasonal as well. So kind of extrapolating from what we do know about other coronaviruses, I would expect that to dissipate as the seasons change, but that's certainly not a certainty.
One other thing for me, anybody in the system right now, UK healthcare system, being monitored for
No.
coronavirus?
No.
You mentioned that UK is a research hospital. Is the hospital kind of assisting the CDC in any kind of way in monitoring or looking or researching this virus?
We're not actively doing any research on this now.
Any other questions? All right. Thank you all very much.
Thank you. Good job.